a gross monthly salary of 470,000 shillings as below, basic salary of 203,000, house allowance of 56,000, commuter allowance of 20,000, emergency call allowance of 80,000, non-practice allowance of 60,000, extraneous allowance of 40,000, risk allowance of 20,000, bringing the total to 470,000 shillings.
After the collapse of the meeting between the unions and the ministries and the Council of Governors, we sat down as a committee and we thought we can bring you all together so that we can have a way forward. We cannot leave these negotiations between the National Ministry of Health, Ministry of Labor, Treasury, SRC, Public Service, at appearance without it coming to a solution. So our coming here is let's discuss on the status of the negotiations as far as this strike is concerned. And we are hoping that out of this meeting, we'll agree on a way forward that can be able to culminate into an understanding that can resolve this matter.
Thank you, Chair. This is our response following the summons that we were given. Honorable senators and members of the National Assembly and distinguished members of the standing committees on health from both houses, we're here today on behalf of the Council of Governors in response to the summons issued on 29th April 2024, placed on 26th April 2024. I received the notice of the meeting the night before and due to exigencies of duty, was unable to attend. Further, letter reference number COG/6/40, volume 93, dated April 25th, 2024, was indeed written to the Clerk of the Senate by the CEO Council of Governors, providing a status update on the questions asked by the committee. Honorable members of Parliament, chairpersons of the both committees, county governments bear the responsibility over county health services, and we're here today representing the Council of Governors to discuss the responses previously submitted as I have stated above. Allow me to present our report as follows. Number one, the issue before the Senate, the status of negotiations with the Kenya Medical Practitioners and Dentists Union, the Kenya Union of Clinical Officers, KUKO, and the Kenya National Union of Medical Laboratory Officers, KUMLO, on the ongoing National Health Workers strike. Our response and the status update by COG. One, on status of negotiations with KMPDU. The court sanctions negotiations between KMPDU and the 52 employers through the Whole Nation Approach Committee collapsed on 22nd April 2024 and 23rd April due to failure by KMPDU to attend the meetings and to execute a return to work formula, rendering all efforts made by the county governments to resolve this long outstanding matter to no avail. This was in spite of all parties having negotiated and initialized the deed signifying acceptance on all issues in the CBA concerning the union and counties. Part of the agreement reached was that the union was to immediately suspend the strike and the union members participating in the strike arising from it to immediately return to work, but not later than within 24 hours of executing the deed. Additionally, the agreement was to be adopted as a consent in court. The county governments executed the 2017 CBA with KMPDU with an understanding that the National Treasury would provide requisite resources to facilitate payment of the basic salary. However, this did not happen, and therefore counties were unable to implement the basic salary provided in the CBA. Nonetheless, all counties have implemented enhanced allowances for doctors as per the 2017 CBA, as shown in the below payslip. A county senior medical officer is paid as follows: a gross monthly salary of 470,000 shillings as below, basic salary of 203,000, house allowance of 56,000, commuter allowance of 20,000, emergency call allowance of 80,000, non-practice allowance of 60,000, extraneous allowance of 40,000, risk allowance of 20,000, bringing the total to 470,000 shillings. Our recommendation: the health function needs to be fully costed and adequate resources available to counties to implement the function. Number 3, on the status of health workers recruited under the COVID-19 Surge Capacity Project, CHAP, and the Universal Healthcare Coverage UHC program. Universal Health Coverage staff. In 2020, the Ministry of Health, through Public Service Commission, recruited a total of 10,000 health workers in various cadres on 3-year contract to work in county health facilities under the UHC program in the Big Four agenda. Number 2, the terms of engagement for these workers were a flat rate of Kenya shillings 50,000 for diploma holders and Kenya shillings 40,000 for certificate holders. The initial 3-year contracts lapsed between May and October 2023, upon which the summit resolved on 12 February that the Ministry of Health extends the contracts for a further 3-year period under the same terms and conditions. Number 4, this was to enable the 2 levels of government to deliberate on transition of these staffs with clear modalities on their terms of employment. However, the Public Service Commission renewed the contracts for the UHC staff only for 1 year, which will lapse between May and October 2024. Number 6, to date, the budget for personnel emoluments for staff under UHC program remains within the Ministry of Health. Number 7, recent development is that the Council received a copy of a letter, reference number SDPH and PS.1/1/170, dated 2nd April 2024, from the Ministry of Health to the Public Service Commission, requesting the Commission to approve the absorption of the UHC staff into permanent terms by the respective county public service boards at the expiry of the current 1-year contract, and determine the mode of treating the period served under contract by UHC staff with respect to payments of service and gratuity. Number 8, the Council responded to the said letter, bid reference number COG/6/40/3A, volume 326, dated 5th April 2024, urging the Ministry of Health, Public Service Commission, and National Treasury to prioritize and provide adequate budget in the financial year 2024-2025 to cater for UHC staff salaries at the prevailing market rates, together with the attendant employment benefits such as medical insurance and pension. Our recommendation: the National Treasury to allocate budget in the financial year 2024-2025 to cater for the UHC workers' salary at the prevailing market rates, including the employment benefits such as the medical insurance and pension. This will enable counties to effect the desired transition of the staff. On the COVID-19 Surge Capacity Project CHAP, Chair, in 2020, the PSC recruited 605 healthcare workers and deployed them to county facilities to support in the management of the COVID-19 pandemic. Currently, there are 441 of the COVID-19 health workers and an annual budget of 674 million working in the counties, but remunerated by the Ministry of Health. The 3-year contracts will expire in 2024. The National Treasury advised the Ministry of Health to inform counties to absorb the 441 COVID-19 workers. Number 4, it is important to note that county governments are unable to absorb their formation staff unless the requisite budget is provided. Our recommendation: the National Treasury, the Ministry of Health to avail adequate budget to county governments to absorb the CHAP staff.
I want to submit that we had indeed actually agreed on all the matters affecting the counties. So the standoff is not as a result of any matter affecting counties. We had a draft agreement which was co-signed between ourselves and the KMPDU, with respect to the doctor strike. So the only sticking issue was the issue of stipends, which for the interns, which we thought was a national government matter. We had expected that the doctors working in our counties will resume work in line with the draft agreement that we had. I submit. Yeah, thank you.
Chair, you know, we are in a situation which would have been avoided if PSC had taken a different decision. For one, the summit is the highest decision-making organ in this country, which is usually the meeting between the executive of the national government and that of the county governments. And therefore, I fail to understand how PSC would have made a decision to extend the contract by 1 year when the summit has given directive to do 3 years. Secondly, those contracts are ending, some of them ended yesterday. Others are ending within the course of this month. Which is the lesser evil? To have those young health workers on the streets, or to extend the terms of conditions under what was presently prescribed as they make arrangements to make absorption. And lastly, Chair, the PSC has given a very, I would call it a dangerous statement. The health workers and the UHC were employed without consultation of the counties. Almost 10,000 of them by the national government. To today say absorb the 10,000 workers without providing resources is transferring a very big burden to the counties without any regard to whether they were ready or not to absorb the workers, which should not be acceptable, Chair.
Thank you.
As we are discussing, for me, I look at mothers and children are dying. And I kept on saying that this is a matter of life and death. And are we really coming up to resolve these issues? We shall go through accusations and counter-accusations, though the matter is in court. Like what doctor has said, why don't we have maybe matters resolved out of court? We can even form a panel of the wise. Dr. Nikal here, he's an expert. One, he's a member of parliament, he's a doctor, he was a PS. Surely, you know, he's also best to resolve such issues. So why don't we have maybe even form a small team, my thoughts, just to resolve these issues. It could be maybe we may not be able, you know, to handle as you know, as a large team. But because we are moving back and forth, and the matters are not being resolved, and the KPMDU, you know, are not even getting anywhere. Mi naomba kwa jicho la huruma, KPMDU and doctors, please go back to work. Tafadhalini sana. Seriously, angalieni, look at what we are going through now, as I said. Apart from whatever, we have mothers who are giving birth, wanakufa, watoto wanakufa, and all the others. Seriously, let us, I even feel that the issues are very, you know, ni kidogo sana zile zitaweza kuwa, you know, kuwa resolved. COG, our very able chair. Let's see how we can come in. Madam Waziri, tuko na waziri hapa, and they are all women, and you understand what we are going through. Please, let us come up with something. Bwana PS, help. I know you are a wise man also. I am trying to plead with everyone because I can see, you know, we are, you know, it's accusation, inaenda huku, inarudi huku. Please let us come together and resolve. That's why we even decided to come together as Senate and National Assembly to resolve this issue. Tafadhali, please.
Thank you, Senator. Vice Chair, you have something?
Yeah, Chair, I agree with everything that has been said. Dr. Nikal, we agree with you. We agree with you. And everything you're saying here was said when we were negotiating. We have appealed to everybody's conscience. We have said how people are suffering. We have accepted everything. On medical insurance, the union said there were 11 counties. Out of 47 that didn't have medical. We said we'll take it up with those counties and they will offer. On promotions, we say doctors will be promoted by counties that haven't started within 1 month. The process will start. Now, if the intransigence on one of the parties because they believe they're indispensable and they have the upper hand, is making Kenyans suffer, what to do? You tell them you are a doctor. Appeal to their conscience and get them back to work. Tell me if there's something the council could do better.
Chair,
that's what's not agreed on. That's what we want. What is not agreed on?
Order, Dr. Nyigal. Allow the Vice
Chair,
Council of Governors to...
among the list of the things that were for the council, and we're not dividing this thing between council and national government because we have any problem with the national government. No. In fact, even on the issues between the union and the national government, because we were in the meeting, we were trying to get because they sat in the same room at the same table, we were trying to get a common position. We have no problem whatsoever on this matter with the national government. But what we are saying is, on the final word on interns, it's with the national government, because it's about how much they ought to be paid. Once they have agreed between themselves and the union, and these interns come to our counties, we'll receive them with open hands. We have no issue. So, if it's about appealing to conscience of someone, it's the conscience of the KPMDU that we need to appeal to. Having come with 19 matters, and having reduced those to the 2 that they are raising now with the national government, and having actually gotten a sign-off on agreement on every matter with respect to the counties, why are they still not getting back to work if they really care about Kenyans? Chair, I submit.
Through the chair.
Honorable Sang, Governor Sang, you wanted to add something?
And Chair, I think the Vice Chair has put it squarely as it is. However, you know, the way to sort out a problem is never to give a blanket condemnation. Because if there is something that is within the powers of a county government, however much you request or ask or beseech the minister, they will not handle, because their hands are tied. It's not their matter. However much you know, on this issue, for example, of interns, you know, we can't do anything beyond, you know, it's a matter squarely in the hands of national government. That is it. On the issues of, you know, releasing doctors for postgraduate training, that can never be a matter of national government. It's a matter of county governments. So we think that this passionate appeal that you are making, if we make it generally and saying Kenya is one, we know Kenya is one nation, but we have various 47 counties, various county governments, various employers. The way to escape responsibility, Dr. Nyikal, is to make a blanket statement. We have presented the issues, we have discussed and negotiated, and we have all agreed that sometimes you negotiate and you get to a dead end based on circumstances beyond the KMPDU officials. The best way is to trace your steps back. You go back to the negotiation table. I hear Senator mentioned that, you know, maybe we have a smaller team. There is, by the way, a team. These negotiations are anchored on a whole-of-nation approach that was crafted by the courts, realizing that we have a crisis in a nation. Let us put together a whole team. In fact, it has never happened before that in the labor movement or in the labor, you know, discussions, that we have something called whole-of-the-nation approach. We have one chaired by the head of public service, with county governments in place, with various ministers, including even national government, ministry, national treasury. For the first time, that was created by the law, by the courts, to try and create a platform for us to engage. It is on the basis of that platform that we had this temporary or this agreement that was reached. Now one side has said we didn't get assigned through by their members or their organs, you know, KMPD organs. The best place for us is to go back there. Let us then sit down and discuss and agree at that forum. Otherwise, if we create another platform, and we are now here, we have spent about 4 or 5 hours here, why can't we find the headway? And if you want to find headway, Nyikal, every stakeholder must take responsibility. We have taken our responsibility as county governments. And that is why we really feel frustrated that we continue to sit here, despite the fact that we have cleared our bit of the bargain.
And I think the other matters that touches on KMPDU with the ministry will be the next. So I wanted to, the Council of Governors has been here since morning.
Chair, before you release Council of Governors.
I wanted to release the Council of Governors, but I want to allow my colleague, Honorable Mandago, to make a comment.
Chair, before you release the Council of Governors.
Dr. Atela,
yes,
1 minute.
I just want to point out that as you asked my colleagues on what then would are remaining, that if we are sorted out, the Council of Governors will be quite okay. Number one is on the harmonization of terms of the doctors across the counties. That is actually in disparity. And number two is revising and changing that term of promotions. Once those things are sorted, I am very sure that we'll be in agreement with all the issues with the county.
Now,
Yeah, before you close, when you see, I think we are now moving, because what we are getting is, I know that the governors would like to go, and they have been here for long, but you erase the issue of interns, you raise the issue of postgraduate doctors, and now you've brought in harmonization. Now, these ones, and I would like to get the attention of the governors. I would like to get the attention of the governors. These three things, interns, postgraduate doctors, harmonization, as much as they may not be directly under the governors, they affect the governors gravely. So that as they leave and we discuss it with the ministry, we must realize, I want to give an example. Interns, they work with you most of the times. And whatever decisions we make, you know, this money. Even if the money comes to you, Sinatoka Treasury, even if it goes to the ministry, it's just the route it follows. Some go to the ministry, then to the employees. Some go through you and then to the employees. So we can go there. So if we then will agree on that, we should take that is a matter coming. Postgraduate, I've never agreed with you more. And the minister knows my view. They should be paid nationally, because then it releases your money so that you can employ people on contract terms when they're away. So we have to convince those people that what you have got in the division of revenue, let it be saved, you use it. When now we come to manning Kenyatta or manning Moi, because those guys are manning Kenyatta and manning Moi. If they are not there, those places do not work. So these are the areas we are thinking about. So as you are going, don't think that now it's nothing to do with you. I believe that we can come back later then when we are now moved one step forward. The whole nation thing is going on, but if there is another input that makes things easier, why not?
Thank you.
That's my position.
I wanted to give
thank you.
I want to give a commitment of a day for the KPMDU, so we
No, before you go there, I think we are making good progress. But I just wanted to say a few things in regard to KMPDU. And I think one of the things I would want to say to the unions, you know, when we engage, and we have sat down to engage, let's engage in good faith. Let us be honest. When we have agreed on a position, let's stand by that. And if, for some reason, our advisory council, whoever doesn't agree, let us be candid to say we had agreed, but when we reverted to our council, it was not agreed, so that we know where we are starting from and eliminate any confusion. That's number one. Number two, there are things, and I heard one of the union people say that there was a declaration in Kericho. And if you remember very well in that declaration, we agreed that the Human Resource Advisory Council will deal with the harmonization processes progressively in place of the Health Service Commission. So where have you thrown the Human Resource Advisory Council? You know, we must find progress and some good direction. Number three, even as we release UOG, so that also can be you think about. The reason why we had devolution in the first place and why Kenyans decided that we must have devolution was to make sure that we have equitable service across the country. Now, a county like Mandera, a county like Wajir, where you know your members, if they are transferred today, the next thing they will seek is a transfer back to Nairobi. If you tell us to harmonize these salaries so that they are uniform, the reason somebody else is in Mandera today or Marsabit is because Marsabit has decided in the salary band for senior doctors, I'm not going to start with the entry level just to incentivize your member to be in Mandera or in that place. What would be outrageous if that is what is happening is if salaries are being paid outside the band. I think that is something that would need to then be addressed. Finally, I would also want to ask, if there are only 11 counties with issues, should we really have a national strike? And as Nikala said, on the issues of interns and postgraduate training, I would want to ask the union, what case do you have against counties? They have released you to go and study. Your salaries are being paid. You have a problem with Kenyatta or national government. Why should we have a sympathetic strike? And the final question is, now that we have referred to court matters that have been here, the court has said there must be a minimum service. And it has since established that you will need to recruit 25,000 to have minimum service. In short, as a nation, we don't even have minimum service with the current employment. So it means everybody should be at work until we attain the minimum service. But that is not to say that there are no issues that needs to be addressed. One of the issues I agree with counties and national government, and I'm happy the cabinet secretary is here. This is a matter that has taken so long on the table. The issue of doctors going on studies, the Minister of Health, national government must take up paying their salaries. I think that is something that we should not even go around debating. Let's only agree when do we start. The fact of the matter is we cannot start in the middle of a financial year. We have an opportunity now that we are heading to a new financial year to set some records straight. Finally, for Council of Governors, when I listen to the Clinical Officers Union and their issues stem more of your absence from engaging. I want to encourage you, you know sometimes, and you know I've been in COG, sometimes the letters are not properly addressed, Chair. Don't worry, even if they're addressed to County Secretary, because we are addressing a matter of national interest, let's just deal with this matter so that we are able to resolve. I like the commitment and the goodwill that all of you are willing to engage. This is what we need to do with the remaining part with national government. And CS, on that matter of interns and so forth, we are not asking you to make a decision here, but just know that, generally speaking, when doctors go on studies, the law is very clear. You people must take up that responsibility. And I'm happy Dr. Nyekali is saying it will allow counties to employ doctors on contract. So that contract is what we also need to discuss. And I think PSC has given an advisory in terms of the terms of service for equal pay, for equal duty. I think the other matter that needs, so that even when COG lives here, is the issue of UHC workers, those who are employed by national government. If a decision needs to be made, of course you know what to do. Resources follow function. You release the function, you release the resources that accompany that function, then that matter is closed. I think there is no issue. So let's finalize on the issue of KMPDU. And I think the issue of interns is a very hot matter. And as we allow COG to leave, just know that, as Nikala said, interns functionally is an issue of national government, but it affects you because they also work in the counties. And finally, there has to be some proper arrangement on that matter. So I think with that, we shall allow COG to, unless...
give your closing remarks.
Thank you, Chair. On behalf of the Council of Governors, we want to take this opportunity to appreciate both the joint committees of the National Assembly and the Senate for this session. It's unfortunate that we have had to take such a long time before this matter is resolved, and we hope that this will be the last time we are getting into these issues and that the unions will finally make a decision to go back to work. We've given our commitment on the issue of engagement with KUKO, which is Tuesday morning at 10. And on the matters that have to do with KPMDU, all our issues were resolved and agreed, and the ones that are not, we've been in the same meetings with the national government. They're aware on interns, which they will address, and on matters UHC and the COVID doctors, if they're to be absorbed by the counties, then the resources would have to follow the functions. Other than that, we take this opportunity.
You are to give a date for harmonization, yes, to listen to the KMBDU?
Also, before I finish, I would like to give the timeline for the KPMDU as Tuesday at 2 p.m. So KUKO is at 10 and